Good morning, everybody, and welcome back to your Lunch Break Live. My name is Ivana Harinkyu if you're new here, and if you're not, thank you for coming back. Today is Thursday, November the 18th. And today, I know we're getting all sick about coronavirus, but today we're going to talk a little bit about COVID vaccines and those for people who are awaiting organ transplants. Now, we have heard throughout this pandemic, there are people that are more susceptible to COVID and more people who are in these classifications that are needing vaccines more. Something, though, we haven't heard as much about are people who are awaiting organ transplant or those who have maybe just recovered from an organ transplant. Now, today I am joined by UAB nephrologist and professor, Dr. Vineeta Kumar. And Dr. Kumar is here today to talk a little bit about UAB specific policies regarding patients who are awaiting organ transplants and just about COVID vaccines and the effect on coronavirus for these people as well. So, Dr. Kumar, thank you so much for joining us today to talk a little bit about this. There's something I want to quickly kind of debunk while we're here, right? Let's just start off and do it. A couple of months ago, we saw a report from a national publication that said there are a lot of hospitals and transplant centers across the country that are requiring people who are on these lists. And if you're not familiar with what I'm saying, or if you've never had a loved one who is waiting for an organ transplant, that is essentially a waiting list for your loved one to get that organ. So this report said there's a lot of hospitals and transplant centers where people on the waiting list are having to be vaccinated or risk losing their spot in line, essentially. Now, can you tell us a little bit about UAB's policy on that, and if UAB is requiring people on that waiting list to be vaccinated against COVID-19?
Thank you, Ivana, for asking that question. And UAB, we are strongly encouraging our patients to get vaccinated. We are not denying patients a transplant if they're not vaccinated. We have not mandated it. Our patients will not lose their spot on the list, but we definitely are very strongly encouraging the vaccine use because the protection from the vaccine is tremendous and we want our patients protected.
So if you were on the list awaiting any type of transplant, I know you do a lot of kidney transplant at UAB, and that is your kind of field of study. If somebody is awaiting a kidney transplant and they choose to not be vaccinated, you're saying that they won't get kicked off of that list.
Correct. They will not get kicked off the list. We will still transplant them. We'll engage with them in a conversation of why we want them to get transplanted, because their chances of being protected with the vaccine if they take it before transplant are significantly higher, and the risk of dying if they contracted COVID after transplant, if they're not vaccinated, is higher. And for those reasons, we want to protect our patients. We don't want to lose them. And so we will have a conversation with them, but we will not deny them a transplant.
I think I'm glad you brought that up because I think that was part of the kind of speculation as to why many hospitals and transplant centers were requiring COVID vaccinations, because they say, look, if you're needing a transplant, you're already more susceptible to health problems, to viruses and things of that nature. So if we give you a perfectly good organ, you do not choose to get vaccinated, and then you contract coronavirus and pass away, they've essentially wasted that organ. So that was kind of the speculation and the argument I think that a lot of these medical centers were using. So what do you think about that argument?
Absolutely. I wanted to just sort of first start by saying where that feeling of that patient should be vaccinated before transplantation actually stems from a good place. We as humans are not wired for loss of health and for death. And if you add the layer of being a medical provider, that intensifies exponentially. We do not want to lose our patients or see them sick. And COVID has left many of us feeling helpless, where despite all that we do, but despite doing all the things that we know how to do, we've had to watch our patients die. Now, if you believe that there is a way to prevent that loss or that level of sickness, and that vaccination is one of the ways to do that, and vaccination reduces the risk of illness or death or dying, then isn't it totally understandable that centers will take the stance, vaccinate or else no transplant? So it really comes from a good place, and that's why some of the centers have started to think even about vaccine mandates. Patients pursuing solid organ transplants are encouraged to receive many other vaccines on an accelerated timeline. And we know vaccination prior to transplantation offers the best chance of developing immunity. And furthermore, transplant recipients are at really great risk for acquiring vaccine preventable illnesses or succumbing to severe sequelae of such illness. So the primary driver is that. Now, as you brought up, Ivana, the additional arguments that support vaccine mandate policies are definitely motivated in addition by utility and stewardship. Um, so what I mean by that is that the waiting list, on an average of every 10 patients that wait for an organ, only one ends up getting an organ. So most people die waiting for an organ. And in that scenario, you can see how organs are a very scarce resource. And the governing body for solid organ transplantation, which is the Organ Procurement and Transplantation Network, we call it OPTN, it tells the caregivers, the transplant providers, and centers to serve as good stewards or gatekeepers to these transplant waiting lists, because the fundamental thing that we are charged with is to maximize benefit for the greatest number of patients and have fair distribution of resources. So at the individual level, patients who are under vaccinated face greater risk of poor outcomes for themselves and their grafts. And then at a global level, that when we lose a patient, or they get ill and their organ suffers, that's the loss of an organ that otherwise would have had a lot more life in it. And so that's sort of where that whole argument of a scarce resource, and why we need to facilitate the best outcome for that organ comes into place. So
That
that's sort of, yeah.
I was going to say that's a really good explanation of that, and I love that you're able to say, "Look, we're not doing this at UAB." And two, I know some people kind of dropped in a little bit later on our conversation. So just to quickly kind of recap, there are some medical centers across the country who are saying, "Look, we're going to take you off of the organ waiting list if you are not vaccinated against COVID-19." UAB is not one of them. If you are not vaccinated against COVID-19 and you are on that list, you're not going to lose your spot at UAB. Now, if you're at another transplant center and you're on their waiting list, I would say that you probably need to check with them. But UAB is not requiring those at this point. But I think that it's very respectful, Dr. Kumar, that you can kind of say, look, this is why we're not, but this is why some people are. And this is the reasoning there. Now, I'm going through a couple questions here. We've got, and I know that we have some other topics we want to talk about, Doctor, but first I want to get to a couple questions that I've got for you. So I've got one here from Doug, and Doug says that he had a bone marrow transplant last year at UAB. And, we're so glad that you're doing well, Doug. You obviously are doing well enough to be here and watching us and commenting. We're so glad to hear that. But I know there's a lot of people like Doug who say, look, this is, what my health is like at this moment. Should I get vaccinated? In his case, he asked if he should go ahead and get a booster shot. So let's talk a little bit about people who are recovering from organ transplants and how important vaccinations or booster shots are for them.
Absolutely. Doug, I am so glad you asked that question. About you're essentially getting at, if you already have a transplant, do you need to get vaccinated? And more importantly, if you've been vaccinated, should you get a booster vaccine? So the big picture is, we know now unequivocally that transplant patients have much severe disease, or can have much severe disease from COVID-19 infection, and they're more likely to require hospitalization or intensive care, or to die. And this is because of the anti rejection medicines that make their ability to fight the COVID-19 infection not as well. Their ability to fight the infection is extremely reduced. I have personally lost more transplant patients this year to COVID than in my entire 17-year career in transplant. And we do know that vaccinations work in patients who have received a transplant, and it has reduced hospitalization, severe illness, and death in many transplant patients. However, they do not work well in all patients. So patients after transplant who've been vaccinated still can get sick. They work better before transplant, as we talked about. But long story less long, we need our immune system to mount a necessary response to the vaccine. And the 2 doses of the vaccine that transplant recipients get, they do not, some of them, so a subset of them, a large subset of them, do not get enough of a boost from the 2 doses that is required for the vaccine to work, compared to the general population who has a strong immune system and can have that boost. So the idea of that third dose is actually very separate from the booster dose that the general population gets. In transplant patients, the recommendation is your primary vaccine series is 3 doses. If for the general population it's 2 doses, for a transplant recipients it's 3 doses. Get your 3 doses. That gets you that initial enough of a vaccine response. And then after you've had your third dose, once 6 months have passed, for some of you, it's after you've had your second dose because the recommendation for the third dose just came out. So essentially, after you finish your primary vaccine series, at about 6 months after that vaccine series, the idea is that the antibodies are now starting to decline, and that's where the booster dose comes in. So again, transplant recipients, they get 3 doses of the primary vaccine response, so they're just getting their vaccine. And then they 6 months later get the fourth dose. If you've already had your 2 doses and it's been more than 6 months, go ahead and get that booster dose.
That was one of the most clear and concise explanations I've heard over booster versus third dose. That has been something, doctor, that I know so many of us who are not in the medical field have been very confused about, because you hear some people saying booster, you hear some people saying third. And I've had questions and I've heard questions from many of our audience members saying, well, is that the same makeup? Is what is in that vaccine the same? And what's different about a booster? What's different about a third dose? But I thought that was really interesting that you said that people who are immunocompromised, such as people recovering from a transplant, don't even think about it in terms necessarily of boosters and the number of doses. You think about it as like, look, for me in my situation, recovering from a organ transplant, I need 3 to complete my series, and then I need a booster. So I thought that was a very clear way to put that out, and I hope that a lot of people really play that back and take that in just a little bit.
You summarized that beautifully, Ivana. Thank you. That's perfect. Yes.
It, and again, this is something we've talked about a lot, but I know people who are immunocompromised, who are recovering from transplants, it is more important for them, arguably, than a lot of other people. You said something that we don't need to gloss over, and that is that you have lost more patients during the pandemic due to the pandemic than in your 17-year career, is I believe the number you said. That is horrifying. And that's something that we don't need to gloss over, and we do need to talk about, to say, look, these people died of a virus and not of what they probably expected to die of, right? Of waiting on that organ. And that's tragic.
Absolutely. I have to share this event that happened to me 2 weeks ago, where I I'm in a business where I have to tell patients bad news. But with that bad news, I'm always able to offer hope and support. And if not anything, I say, I'm going to walk this journey with you, whatever the outcome. You're not alone. We're going to do it together. And I mean it with every fiber of my being. When it came to our COVID patients, when they got sick and if they were in the ICU and they could talk, there have been a few patients, more than a handful, and the most recent time this happened was 2 weeks ago, where they held my hand and said, Dr. Kumar, please tell me I'm not going to die. And I can't tell you, I tell them we're here, we're going to take care of you, but in my heart of hearts, I don't know that I can save them. And there are certain patients that I know are going to die, and it absolutely destroys you. That's been one of the hardest things. And it happening once a year is hard enough, but when it happens over and over, it just really, really destroys you sometimes. You really have to dig deep and remind yourself that there's so many patients and so many people that do have their health, that do need you, that you still have meaning, that you can still make a difference. But it's a talk you have to have every day with yourself when you lose a patient. And I just don't want to lose anymore.
I can't imagine. And I have to ask as well, is it something that you probably are unfortunately a little bit more prepared for mentally is losing a patient due to not getting their transplant. That is the career path that you have taken, and you're aware of that. You're a smart person, you're aware of that. But is it almost harder to lose a patient to COVID, into this virus, where you have not been prepared for it? The organ transplant list we know is a nightmare for many people. And as you said, they unfortunately, you kind of can see the odds and kind of can say, well, maybe I'm going to die from this. But this is the pandemic is something kind of out of the left field that you thought, well, I'm prepared maybe to lose my patient, is how horrible I'm going to feel. I'm prepared for this to happen. And this is an odds. These are the odds I'm playing. But the pandemic changed all of that.
Absolutely. I mean, you're absolutely right, Ivana, that most everybody that goes into transplant, or everybody that goes into transplant, recognizes that we have a scarcity of organs, and our patients are as likely to die on waiting for an organ as actually get their organ. So many of us at UAB, I can count at least 50 people who have made it their life mission of how do you bridge that gap between the number of patients waiting for a transplant and number of organs available. How do you get that gap closer and closer? And so we've dedicated our lives to it. That's our driving force. That's a big thing that gives us meaning long term. And being a kidney patient, I'm utterly grateful that we have dialysis because it keeps our patients alive. For our heart patients and our liver patients and lung patients, there's no heart or liver or lung dialysis. So dialysis, at least for a kidney population, keeps them going. However, patients on dialysis for 2, 3, 4, 5 years continually tell us it is not what they have signed up for. This is just something that they are getting by, waiting for that organ. So, in that milieu, you're absolutely right, today losing patients. However, we're still trying to do something about it. With COVID, from day one, we did whatever we knew, however we knew to do it. And none of our training, our expertise with a subset of patients has helped prevent their loss. And transplant patients specifically have been identified, highlighted as a group of patients that our efforts sometimes run short. Ivana, does that answer your question? I think I get passionate sometimes talking about this, but I hope I got to the meat of what you were trying to ask.
Absolutely, and, that is look, that's what doctors are supposed to do, right? Is be passionate about that, so we thank you for that. I wanna ask you a couple of more medical questions when we talk about people who are recovering from transplants, or maybe if you're just immunocompromised in general, and that could be, like you said, people on dialysis. That can be people who are just maybe on the brink sometimes. We know that if you are maybe not quite at the point where you need to be put on an organ transplant waiting list, you
Mhm.
can still be pretty close. You can still be very sick, and there is a threshold there. And it's if you're not quite meeting it, you are still very sick and still immunocompromised. So let's talk about those people. And again, you talked about the importance for getting vaccinated against COVID-19, but let's talk about the possibility of these long haulers for COVID that we talk about. We don't know what the effects COVID will have on people who had COVID in the future because it hasn't been here before, right? We haven't had time to study it.
Correct.
So, is there a worry that those long hauler symptoms could be worse in immunocompromised people than in a healthy person?
So, Ivana, at the present time, what we don't know is the correct answer. We are not finding that COVID patients necessarily have more of the long haul, or sorry, COVID patients are more likely to develop the long haul symptoms compared to let's take it back. Transplanted patients who get COVID, we're now finding that they're more likely to get the long haul syndrome compared to the general population who doesn't have COVID and gets the long hauler syndrome. But if they do get it, if transplant patients do get it, is it more severe? Does it last longer? We actually don't know that. You're absolutely right. This is something that will need time. Scientists are actually actively following post COVID recovery, especially in transplant patients. There are long term follow up with these patients that's happening. We are seeing similar things that are being seen in the general population. Biggest hits to the body are kidney and heart for our transplant recipients, followed by some neurologic symptoms. Those are the three things. So, headaches, jitteriness, tingling, numbness in the brain area, in the heart area, reduction in heart function, arrhythmia, so abnormal heart rhythms. The devastating thing for many of our COVID patients who've recovered from COVID has been significant loss of kidney function, whether it's their own two original kidneys or transplant kidneys. And a subset of them have ended up losing either their original kidneys or transplant kidney and ended up on dialysis. And then beyond that, the other whole COVID long haul of never thriving and never getting back to your pre-COVID baseline. So far, we're seeing that transplant patients, for the most part, are bouncing. The ones that have mild disease are bouncing back and doing really well. The moderate to severe ones are the ones that are left with significant residuals.
I want to ask you as well about kind of the other side of this coin, and that is people who want to donate their organs,
Yes,
whether that be a living donor where you want to donate something like a kidney to somebody, or whether that be if something happened to you and you pass away, you
right.
want to have the knowledge that when you go, your organs will be benefiting somebody else. So if you are an organ donor in either of those two situations, what happens if you're vaccinated? Are you still eligible to be an organ donor? And same for the other side. If you're not vaccinated, are you still eligible to be an organ donor?
Fabulous question. And gosh, donors, our living donors, our deceased donors, are heroes. We won't be able to help our patients the way we do if it wasn't for these incredible families and people who come forward to be organ donors. So thank you, thank you, thank you from the bottom of our hearts. So vaccination. Vaccination does not affect one's status to be a living donor or a deceased organ donor. You can be an organ donor whether you're vaccinated or not. For our living donors, especially kidney donors, which is the most common living organ category, followed by liver donors. So for our kidney donors, one reminder is that you're left with one kidney. And as we just talked about, COVID is known to cause kidney injury. So that if you're left with one kidney after kidney donation and you get COVID, then you are at risk for having injury to that other the remaining kidney. So, if possible, protect yourself with taking the vaccine and, more importantly, take measures to prevent COVID. And that is absolutely vital. One other sort of contextual thing, our potential living donors, we we are sort of part of our responsibility to our living donors is to tell them how their gift is being used. And so today, common practice is we actually will tell our living donors it's going, you want to donate to your father, your sister, your friend, or your child, and the likelihood of this organ that you're giving doing well in your recipient is going to be X, Y, or Z. We give them an actual idea. And so part of that outcome discussion that we have, we also have to let our living donors know that if their organ is going into a recipient who may be refusing vaccination, and that may put the recipient at an increased risk for adverse outcomes, the living donors are giving a gift of life. And part of the ethical and moral responsibility is for them to know that about their recipient, just like we would tell them about other aspects of outcomes for their recipients.
That's a good point that you make, especially somebody who is a living donor making that immeasurable gift and getting to at least have that knowledge and deserving that knowledge. This is something that you and I talked about before we went live here. That unfortunately on social media we see something once and it sticks in our minds. And I know that there has been so much misinformation about vaccines. We have seen the fertility claims that have been completely debunked by all medical professionals saying that vaccines do not cause infertility. But we've seen some things similar with the organ donation question. We've seen some people posting things on social media that said, well, don't get vaccinated because then you can't be an organ donor. So it's important that we get a professional here who can clear these things up, and just that we remember not everything we always see on the internet is true, and to come to professionals like yourself.
Absolutely. And thank you to everybody watching. It means that you are really vested in this, interested in finding out information. And so please ask your questions. That's what we're here for.
Absolutely. If you have any questions for Dr. Kumar or any other medical questions as well, and if you don't have access to a medical provider, feel free to drop them in the comments, or you can email them to me and I will get them to a medical professional. We've been doing that at AL.com and trying to connect you with experts who can answer your questions. So, Doctor, thank you so much for all of your information today. Everybody watching, thank you so much, and we will see you tomorrow.